Okay, we've hit the magic 300 number. The time is 6:31. So Viljabhai, over to yourself.
Hello everyone. Jai Sri Swaminarayan. Jai Sri Krishna. Namaste to all the members of the community. On behalf of the members of the Board of Trustees and the members of the Managing Committee of SKLPC Patel Samaj Community UK and the members of the community as well, I welcome you all to today's webinar and hope that you will gain something for the betterment. Last year has been unusual and testing to us, and let's hope that we have vaccination for COVID-19 which is being treated. Let us pray that we will see some, if not more, light in the tunnel, resulting in meeting each other and back to our normal life. For those of you who are in good health, I wish you good health continues and pray that you stay safe, strong, and well, and be blessed. For those affected, let us pray that we have blessed with the strength to overcome any obstacles, physically, mentally, and financially. In life, there is always someone, somewhere, in worse situation than us. Let us pray for those in most need, that they be blessed with health and happiness in 2021. ભાઈ તથા બહેનો અને વડીલો અને માવિત્રો, શ્રી કચ્છલેવા પટેલ સમાજ કોમ્યુનિટીના ટ્રસ્ટીગણ તેમજ કાર્યવાહી કમિટીના સભ્યો વતીથી હું આપ સર્વને જય શ્રી સ્વામિનારાયણ, જય શ્રી કૃષ્ણ અને નમસ્તે પાઠવું છું. ખરેખર આનંદની વાત છે કે તમે આપનો કિંમતી સમય ફાળવી અને આજની આ આપણી વેબિનાર સેમિનારમાં તમે જોઈન ભેળા થયા છો, તે જોઈને ખરેખર આનંદ થાય છે. આપ સૌ જાણો છો તે પ્રમાણે આપણું ગયા વર્ષ બહુ જ દુઃખદાયી હતું, જે આપણે જુદી જુદી રીતે અનુભવ્યું હશે. તે ઉપરાંત આપ સૌ જાણીએ છીએ તેમ આપણું COVID-19 નું વેક્સિનેશન જે અત્યારે સારવાર ચાલુ છે, તો તે વેક્સિનેશન લીધે કરીને આપણે બધાએ ભેગા મળી પ્રાર્થના કરીએ કે નજીકમાં આપણે બધાએ જેમ 2 વર્ષ પહેલા એકદમ મોજ મજા અને એકબીજાને હળી મળી અને મળતા હતા, એવું ને એવી રીતના પાછા આપણે મળતા રહીએ. જે આપણા જ્ઞાતિ ભાઈઓ બહેનો બાળકોને કંઈ બી કોવિડના લીધે તકલીફ થઈ હોય તો આપણે ચેતવીને રહીએ, અને જે તંદુરસ્તમાં હોય એટલે કે હેલ્થી હોય તો તેમને પણ આપણે વિનંતી કરીએ કે પાછા એવા ને એવા હેલ્થી રહેવાનું ટાળવી રાખે. જિંદગીની અંદર હંમેશા ભાઈ તથા બહેનો આપણે જે તકલીફમાં હોય છે એને આપણે જોવા જોઈએ, અને આપણે ઘણા ભાગ્યશાળી છીએ કે આપણે કેટલા બધા સુખી છીએ. તો અંતમાં આપણે અગેન ભેગા મળી પ્રાર્થના કરીએ કે 2021 કોવિડનું એકદમ સારવાર સારખી રીતના થઈ જાય. એમાં પણ આજે આનંદની વાત છે કે આપણી જ્ઞાતિના યુવાન ડોક્ટરો, જે આપણા ડૉક્ટર સુનિલભાઈ તમને ઓળખાણ કરાવશે, ભેગા મળી અને આજનો પ્રસંગ જે છે એમાં કેટલી બધી મહેનત કરી અને સાથ અને સહકાર આપ્યો છે, તો તે આપણા યુવાન ડોક્ટરો ભાઈઓ બહેનોનો પણ જોઈને ખરેખર આનંદ છે. With this little message, I have great pleasure to introduce and welcome Dr. Sunil Bhuria, who is consultant cardiac surgeon and a director of surgery, and the trustee of our UK Samaj as well, who will introduce his team of our community doctors for today's meeting. અંતમાં ભાઈ તથા બહેનો, મને તમને જણાવતા આનંદ થાય છે કે આજનો હવેનો જે બાકીનો પ્રસંગ છે તેમાં આપણા જ્ઞાતિના જ ડોક્ટર સુનિલભાઈ ભુડિયા, જેઓ કન્સલ્ટન્ટ કાર્ડિયક સર્જન છે અને ડાયરેક્ટર પણ છે, અને સાથે સાથે સમાજના ટ્રસ્ટી પણ છે. તો હું ડોક્ટર સુનિલભાઈને વિનંતી કરું છું કે આપણી જ્ઞાતિના યુવાન ડોક્ટરો કે ભાઈઓ બહેનો જે આજનો વેબિનાર ચલાવશે તેમને ઇન્ટ્રોડ્યુસ કરે. ડોક્ટર સુનિલભાઈ બુડિયા, થેન્ક યુ.
વેલજીભાઈ, ખૂબ આભાર તમારો. આપના પ્રેસિડેન્ટ SKLPC UK ના, અને thank you to all the committee members and board of trustees of SKLPC UK. Most of all, I'm very grateful to a very strong and learned panel members we have for today, and they've worked really hard to put this webinar together. And as Wiljiba has already mentioned, Apna President, that loads of people have been affected, and I'm sure we know someone that has been affected by this and has sadly passed away. We work in a hospital. We know loads of our community members who have passed away, and it is quite sad. So I hope the next hour or so will be very informative to you and make sure that we impart the correct information for you. And one thing we should remember, the information that we're giving you today is correct as of today. As we know, this information keeps changing. Tomorrow the government may put out some different guidance, but as of today, this is the correct information we have. And with that, I will introduce, or I'll ask our team to introduce themselves. I'm Sunil Budia. I'm a cardiac surgeon at Hayfield Hospital, and I'm from Gam, Manukwa. Nisha. Okay, Ketna, you can introduce yourself.
Yeah, so my name is Ketna Halai. I'm a GP in Brent. I've been a GP for 13 years. I'm also clinical director for NHS Brent. So I've been involved in the COVID response in Brent, as well as the response to COVID across North West London. I'm from Gam, Madhapur.
Hina.
I'm Hina Pindoria from Gam, Suparoha, and I'm a GP.
Jitendra.
Hello, hi, my name is Jitendra Siani. I'm from Gam, Manukwa, and I'm working in intensive care at Basildon Hospital, and I also work at A&E in Princess Alexandra in Harlow.
Dipti.
I'm Dipti Hirani. I'm from Gam, Madhapur, and I'm a GP based in North West London.
Ketan.
Hi there, I'm Ketan Vekaria. I'm a GP trainee and I'm in North West London.
Preeti.
Hi, I'm Preeti Wasani. I am a GP registrar at St. David's Practice in Stanwell, and I'm from Gam, Samatra.
Anjana.
Hi, I'm Anjana Vekaria. I'm from Gam, Narampur, and I'm a GP trainee.
Dhruti.
I am Dhruti Hirani. I'm from Gam, Surajpur, and I'm an F2 doctor on rotation currently at St. Mary's Hospital.
And finally, we have Nisha.
Hi, I'm Nisha Pudia. I'm from Gam, Manukwa. I work at Royal Brompton and Hayfield Hospital as a lead pharmacist specializing in intensive care medicine.
Okay. Dr. Ketan will start off, and he'll start with a reminder on the COVID symptoms.
Yes, hi everyone. So firstly, just to recap on some things you may already know before we go into more detail about the vaccine. With COVID, some people can have lots of symptoms, and some of them are more common than others. The common symptoms are fever, cough, tiredness, and the change in your smell or your taste. Now, some people have one of these symptoms, some people have a few of these symptoms, but some people have none of these symptoms. So it's important that if you're feeling, unwell and you have any of even the less common symptoms like sore throat or headache, upset tummy, aches and pains, that you get a COVID test done and you follow the isolation rules. Like I said, some people don't even have any of the symptoms. Just because you don't have a fever doesn't mean you can't have COVID. So it's really important to keep everybody around you safe, and you can do that by getting a test done. The serious symptoms that you should immediately call either your GP or call 111 is if you're having difficulty breathing, if you've got pain in your chest, you're confused, or you feel like you're having real difficulty, getting out of bed because you feel so tired and so breathless. There is one thing that maybe the public aren't quite so aware of, and that is what we call silent hypoxia. What that means is your body doesn't quite have enough oxygen, and it causes you to become unwell, but you don't feel that unwell yet. But it can be a rapid deterioration in your condition. And we do see, unfortunately, lots of people who suddenly have a rapid deterioration, and they can often end up either in intensive care, or worse, they can end up dying at home. So it's important to contact your GP or 111 if you feel that things aren't quite right. Thank you, Sonal.
Thank you, Ketanbhai. Ketanbhai, આપના બધા ઇંગ્લિશમાં એક્સપ્લેન કર્યું બધું કે આપના સિમ્પટમ્સ કેવા હોય. ટૂંકમાં તાવ આવે તો આપને હેલ્પ માંગવાની ને નંબર આપને કીધો 111 ડાયલ કરવાનો. પણ ઇન્ટરેસ્ટિંગલી આપના હવે ખબર પડે છે કે આપના ઘણા એવા વ્યક્તિઓ છે કે કાંઈ બી સિમ્પટમ્સ ન હોય તોય બી લોકોને કોવિડ હોય ને એ લોકો સ્પ્રેડ કરી શકે. તો એની બહુ ધ્યાન રાખવાની જરૂર છે. એક વસ્તુ અમે કહેતા ભૂલી ગયા હતા કે કાંઈ બી તમારા કાંઈ ક્વેશ્ચન્સ હોય તો ઓલા ચેટ બોક્સમાં તમે લખશો તો અમે એન્ડમાં તમારા બધા ક્વેશ્ચન્સ આન્સર કરી શકશો. For all the people, if there are any questions that you have, please put them in the chat box so that we can try and answer them at the end. However, we are hopeful that by the end of this presentation, we would have answered all the questions. Preeti Ben, you're next on the mental health.
I just wanted to, make everyone aware that mental health is and well-being is foremost in this pandemic. As you must have seen in the news, there's increased domestic violence because, partners have to stay together for longer. They can't stand each other. They are physically violent and also, abusive towards each other. There's also exposure of vulnerable children and adults to abuse. This is mainly children from deprived families and vulnerable adults who are living alone, who don't have access to, the social media, and sometimes they get conned into paying for different treatment or diagnosis. So there's a lot of exposure of these people. We must also remember that there's a relapse of mental health of patients with pre-existing medical conditions. Obviously, you must have noticed all the appointments are now online. They don't have any social interaction with other, medical professionals. And this is quite, quite a serious problem. We must not forget our colleagues who are in the medical profession. They are going through depression, anxieties, and they might even suffer from post-traumatic stress disorder. The other problem was financial worries. Most people on furlough may lose their jobs and they won't have an income ever. Who knows? And this is causing a lot of stress. Stigma against people with positive COVID tests is another big problem. People are hiding that they have COVID. They're not telling each other, and then they are blaming each other for passing the disease. And not following social distancing and other government guidance is everyone's responsibility. We must follow this government guidance. It's very simple thing: social distancing, wear a mask, and keep washing your hands. Living with long COVID and its psychological effects will be felt in the future as well. We don't know the long COVID effects in much detail at the moment, but as days go by, this will become more apparent. We must support each other during this pandemic and be kind to each other and acknowledge that carelessness can cost lives.
Thank you, Preeti Ben. મગજની બીમારી છે બહુ ઇમ્પોર્ટન્ટ છે કારણ કે પેલા કોઈ બી આવા પેન્ડેમિક થ્રુ ગયા નથી. હવે બધાને ઘરે બેસીને કામ કરવાનું છે, છોકરાઓ ઘરે છે, બારે આપણે જઈ નથી શકતા, તો આપણે મગજની બીમારીનો બહુ લાગવત પડે છે. તો ટૂંકમાં કહેવાનું કે કાંઈ બી તમને કાંઈ તકલીફ કે થતી હોય તો તમારી પાસે જ ના રાખો, એકબીજાને હેલ્પ કરી આપે. ને વધારે એનાથી કાંઈ સોલ્યુશન નથી મળતું તો આપે ડોક્ટર સાથે વાત કરીએ. એવું નથી કે આપણા જીપી બંધ થઈ ગયા છે, જીપી હજી જીપી છે, એ લોકો આપને ધ્યાન રાખી શકે છે. તો પ્લીઝ ઘરે બેસીને સફર ના થાવ અને એકબીજાને આપણે હેલ્પ કરીએ. ને મોસ્ટ ઇમ્પોર્ટન્ટલી પ્રીતિબેન એમ કીધું કે આપણે જે સોશિયલ ડિસ્ટન્સિંગ કરવું છે, it is very very important. Throughout આપના પ્રેઝન્ટેશનમાં we'll keep saying the same thing. ઈ જ અમે તમને ખ્યાલ રાખશું કે આપણે એકબીજાને કેમ સપોર્ટ કરીએ ને સોશિયલ ડિસ્ટન્સ કેમ આપણે પાળવી શકીએ. થેન્ક યુ પ્રીતિબેન. હવે જીતેન્દ્રભાઈ આપને કઈ જણાવશે વેક્સિન ના ઉપર.
થેન્ક યુ સુનિલભાઈ. સો વેક્સિન્સ ઓલરેડી માર્કેટમાં આવી ગયા છે. કરન્ટલી યુકેમાં તો ઓલરેડી 3-4 તો ઓલરેડી છે. વર્લ્ડમાં પણ ઘણી જગ્યાએ પણ વેક્સિન્સ ઘણા થઈ ગયા છે ચાલુ. તો વાત કરું વેક્સિનની તો યુકેમાં હમણાં ફાઇઝર ઓલરેડી ઘણા બધાને મળી ગયું છે. મેં પણ ફાઇઝરનું લીધું છે. યુએસમાં બનેલું છે. બાયોટેક જર્મનની કંપની છે, સાથે ભેગા મળીને એ વેક્સિન નીકળ્યું છે. અને જે બીજું છે એ છે ઓક્સફોર્ડ એસ્ટ્રાઝેનેકા, જે યુકેનું ઓક્સફોર્ડ યુનિવર્સિટીમાં ડેવલપ થયું છે. અને સ્વીડિશ કંપની જે એસ્ટ્રાઝેનેકા છે, બેલ્જિયમમાં એ મેન્યુફેક્ચર કરે છે. મોડેર્ના વેક્સિન છે, એનું કામ પણ લગભગ ફાઇઝર વેક્સિન જેવું રોલ છે એનો, કે એને કામ એવું જ કરે છે. પણ એ યુએસમાં લગભગ ઘણા બધાને વેક્સિન મળી ગયું છે. મોડેર્ના વેક્સિન છે એ લગભગ 3 લેવલમાં ટ્રાયલ કર્યું છે. 3 જે વેક્સિન છે એ પહેલા ટ્રાયલમાં લગભગ 80 કે 100 જણા હતા કે જેમાં એ લોકો સેફટી માટે ટ્રાય કર્યું કે વેક્સિન સેફ છે કે નહીં. અને એના પછી સેકન્ડ ટ્રાયલમાં લગભગ 100 માણસો ઉપર એ લોકો જોયું કે કેટલો ડોઝ આપવો અને ક્યાં કને મારું, કેમ કે હમણાં તો મસેલો મારે છે ને, એ બધું સેકન્ડ ટ્રાયલમાં એ લોકો બધું ડિસાઈડ કર્યું. 100 માણસો લીધા ને પછી એની ઉપર એ લોકો ચેક કર્યું કે કેટલો ડોઝ અને કેવા રૂટમાં આપશે, કે ઇન્જેક્શન આપો કે ગોળીથી મોઢામાં લેવું કે કેવું, એ ચેક કર્યું. પછી થર્ડ ટ્રાયલમાં ગયું. પછી થર્ડ ટ્રાયલમાં તો લગભગ 30,000 માણસો હતા કે એની ઉપર ટ્રાયલ કર્યું કે પાછું જોવા માટે કે સેફ છે ને આ ડ્રગ બહાર કાઢી નથી પહેલા. તો એ 3 ટ્રાયલમાં ગયું છે. પછી એ લોકો ડિસાઈડ કર્યું કે હવે ગવર્મેન્ટ પાસે જાય ને પછી એ લોકો ડિસાઈડ કરે કે આ વેક્સિન આગળ બહાર કાઢવું કે નહીં. તો એટલે સેફટી માટે કેટલા બધા ટ્રાયલ ગયા છે એ તમને જાણકારી આપી થોડીક. નેક્સ્ટ સ્લાઇડ સુનિલભાઈ. વેક્સિનનું તમને જરાક હું જાણકારી આપી દઉં કે એ જનરલી શું કામ કરે એમ. વેક્સિન એકચ્યુઅલી એક ભાગ છે જે COVID-19 તમે જોવો છો કે એના ઉપર સરિયા ઘણા બધા તમે જોયો છે, વાળ જેવા છે, લાલ કલર તમે જોયા હશે ઘણા બધા પિક્ચરમાં. તો એ કામ એનું એ છે કે એક ભાગ એ સરિયાનો બોડીમાં નાખવાનો. તો શું એનું ઓલું આવશે ઇફેક્ટ, એ જોવાનું છે આપને. તો એમાં એવું છે કે તમે વેક્સિન એક ફેરા લેવો તો બોડીની અંદર એ પાર્ટ ઘરે હું કહું છું કે જે સરિયો છે COVID-19 નો, એ નાખવાનું જરૂરી છે અંદર. એ ઘરે એટલે બોડી એના ઉપર પછી ફાઇટ કરે કે એની વેક્સિન અંદર કર્યું તો એના પ્રમાણે એ જોવે કે આ તો વાયરસ આવ્યું છે, કેદી જોયું નથી એવું વાયરસ, પણ હવે એ લોકોને એટેક કરવું પડે. તો એ વેક્સિન દ્વારા વેક્સિન આપ્યું એટલે એટેક થાય અંદર બોડીની અંદર. અને જે આપણી બોડીની આર્મી છે તમે જોવો છો આ પિક્ચરમાં કે આર્મી તૈયાર જ બેઠી છે કે પાછું હવે એક ફેર આવી ગયું છે જે વેક્સિન દ્વારા. હવે ઓરિજિનલ COVID-19 નું જો વાયરસ અંદર કરશે બોડીમાં તો અમે રેડી જ છીએ એને કરવા માટે. વેક્સિન નું કામ એ છે કે બોડીને સૂતી ન રાખે, જાગતી રહે બોડી, કે એક ફેરા તો ઓલરેડી થઈ ગયું છે એટલે પાછું આવશે તો અમે જાગતા છે, રેડી જ છીએ અમે કે બોડીને પ્રોટેક્શન આપશે. તો એ બહુ જરૂરી છે કે વેક્સિન આપણે લઈ તો આપણી આર્મીને જાગતા રાખી. લોકો તો વેક્સિન ના લીધું હોય તો આપણી નેચરલ ઇમ્યુનિટી કામ કરે, પણ આર્મી હજી સૂતી હોય એકબીજાને જગાડે, બધા ઉઠે તૈયાર થાય ત્યાં સુધી તો ઓલરેડી વાયરસ પણ ફેલાઈ ગયું હોય. એટલે વેક્સિન નું કામ એ છે કે એટલીસ્ટ કે પ્રોટેક્શન આપે ને. સિમ્પટમ્સ છે કોવિડના, તો વેક્સિન લેવાથી એ સિમ્પટમ્સ માઇલ્ડ થઈ શકે, જેવો કે કોઈકને જરાક કોફ થઈ ગયું કે ફીવર થઈ ગયું, એટલું થોડુંક થાય. અને ઘણાને તો મોસ્ટલી તો વેક્સિન એટલે બનાવ્યું છે કે કોવિડ થાય જ નહીં કોઈને, એના માટે તો બનાવ્યું છે કે એક તો સિમ્પટમ્સ ઓછા થાય અને ઘણાને તો થાય જ નહીં એમ. તો તમે જોવો છો કે આ પિક્ચરમાં પ્લેનમાં ઉડે છે કે વેક્સિન મળી ગયું તો એને રસ્તો ઈઝી મળી ગયો છે કે એની આર્મી જલ્દી કામ કરી શકે, જલ્દી બહાર નીકળી શકે આ બીમારી એને આવે તો પણ. એટલે સિવિયર સિમ્પટમ્સ લાગે. ઓકે સુનિલભાઈ નેક્સ્ટ સ્લાઇડ. હવે તમે એમાં જોવો છો કે વેક્સિનનું કામ શું છે કે બોડી આર્મીને ટાઈમ મળે. જો હવે તમે એમાં જોવો છો કે આર્મી વાળા રેડી છે, પ્લાનિંગ કરે છે ઓલરેડી કે પાછું એટેક થશે તો અમે શું કરશી. પણ જો તમને વેક્સિન ન લીધું હોય તો પછી આર્મી હજી ટાઈમ ન મળ્યું હોય કે પ્રિપેર થવાનું કે શું કરશી કે આવશે એટેક તો. એટલે એ લોકોને જાણ ન હોય ને ઓલરેડી COVID-19 તમારી બોડીમાં ફેલાઈ જાય ને સિમ્પટમ્સ થઈ ત્યાં સુધી આર્મી ઉઠે ને જાગે ત્યાં સુધી તો ઓલરેડી લેટ. એટલે વેક્સિન લેવાનું કારણ એ છે કે તમને આપણી બોડીને થોડુંક પ્લાનિંગ કરવાનો ટાઈમ મળે છે. જે એક્સપેક્ટ ઓલરેડી વેક્સિન અંદર કર્યું અને આર્મીને જરાક ધ્યાનમાં આવ્યું કે ઓલરેડી આ બેક્ટેરિયા અંદર આવ્યું છે, ઓલરેડી આ તો ઓલરેડી આ કોપી છે, જે વેક્સિન છે એ કોપી છે, ઓરિજિનલ વાયરસનું કોપી છે. એટલે એ બોડીને ઇન્ફેક્શન ના આપે બહુ, કેમ કે એમાં કઈ છે જ નહીં એવું ઇન્ફેક્શન જેવું. આ તો ખાલી ભાગ છે એનો, એટલે ઇન્ફેક્શન ના આપે, કોપી છે કોવિડનું. એટલે પણ આર્મીને ઓલરેડી ઉઠી જાય, એ લોકો તૈયાર રહી જાય કે એક ફેરો તો આવી ગયું છે કોવિડ જેવું એક વેક્સિન, ભલે ને એની કોપી છે, પાછું આવશે તો અમને હેરાન કરશે. એટલે એ ઓલરેડી તૈયાર જ રહેતા હોય, એટલે પ્લાનિંગ કરે છે ઓલરેડી. એટલે વેક્સિન લેવાનું એટલે જ જરૂરી છે કે પ્લાનિંગ થઈ શકે ઉઠીને કે પાછું આવે તો અમે એટેક કરી શકીએ. ખાલી જાણ કરી દીધું કેમ કે ઓલરેડી નેક્સ્ટ સ્પીકર છે એ ઓલરેડી વાત કરશે બહુ ઓક્સફોર્ડની, પણ એટલું જ ખાલી કહ્યું હતું કે ઓક્સફોર્ડ જે વેક્સિન છે યુકેમાં બનેલું છે, ઓક્સફોર્ડ યુનિવર્સિટીમાં બનેલું છે. અને લગભગ ઘણા વર્ષથી એ લોકો એની ટ્રાયલ કરતા હતા યુગાન્ડામાં અને કોંગોમાં, કે જે એબોલાના પેશન્ટ હતા એની ઉપર ઘણી બધી એ લોકો ઓલરેડી ટ્રાયલ કરેલી જ છે. એટલે આ વેક્સિન બારે આવ્યું, જલ્દી આવી ગયું, કેમ કે ઓલરેડી એ લોકો ટ્રાયલ તો ઓલરેડી એના કર્યા હતા. ફાઇઝર જેટલી વાત નથી લાગતી ટ્રાયલ કરવા પડ્યા, કેમ કે ફાઇઝરમાં તો ઓલરેડી ટ્રાયલ કરવા પડ્યા હતા, આના ટ્રાયલ ઓલરેડી કરેલા જ હતા. એટલે આ વેક્સિન બારે ઘણી જગ્યાએ આવશે, તમે જોશો AstraZeneca છે એ. ઇન્ડિયામાં પણ કોવિશિલ્ડ જે નામની વેક્સિન છે એ એક્ઝેક્ટલી સેમ જ છે, ઓક્સફોર્ડ વાળાની છે, AstraZeneca કંપની જે બનાવે છે એ. અને ઇન્ડિયા સાથે એ લોકો જોઈન્ટ થઈને કોવિશિલ્ડ નામની છે, એ લોકો કોવિશિલ્ડ નામની છે બહાર પાડશે એ ઓલરેડી સેમ જ વેક્સિન છે. એટલે next slide. તો એટલે મારું કહેવાનું એટલું જ છે કે વેક્સિન તમે ગમે ઘણી બધી વેક્સિન તમે જોશો માર્કેટમાં છે, કન્ફ્યુઝ કરવાની જરૂર નથી, કેમ કે બધા વેક્સિન છે એ કામ ને તો એક જ કરે છે. કે વેક્સિનનું કામ એ જ છે કે આ જે સરિયા જેવું તમે જોવો છો COVID-19 ઉપર વાળ જેવા ઘણા બધા, એક ખાલી એક જે સરિયો છે એ ખાલી બોડીની અંદર જાવો જોઈએ, એનું એ કામ એ છે કે એક ફેર અંદર ઘરે એટલે આપણી બોડીને ખબર પડે ને એની પાછળ એની ઇમ્યુન સિસ્ટમ બનાવે, જીસી આપણે કહીએ છીએ એન્ટીબોડીઝ. તો પછી એક ફેર અંદર કર્યું એટલે પછી તો આપણે એન્ટીબોડીઝ બોડીમાં હોય એટલે પાછું ઓરિજિનલ વેક્સિન COVID-19 વાયરસ ઘરે તો પ્રોટેક્શન આપે. એટલે હું તો એમ જ કહું છું એડવાઇસ કે તમે બધા વેક્સિન લેવું જરૂરી છે બહુ. થેન્ક યુ વેરી મચ.
થેન્ક યુ જીતેન્દ્રભાઈ. હવે દીપ્તિબેન વધારે આપને શીખવાડશે, હવે ઇંગ્લિશમાં બોલશે.
Thanks, Phil. Hi, everyone. So I'm just going to speak a bit about how the different types of vaccines work. But I just wanted to start off with a few important points about why we're having this discussion in the first place. So I'm sure we're all aware about the devastatingly high number of COVID cases and we've got at the moment, and sadly the death rates are really, really high as well. So the reason we're doing this talk is just to hopefully inform you better as to why it's so important to get vaccinated if you're eligible. So the NHS is already really struggling, the intensive care capacity, they're really struggling as well. And what we're also seeing is that lots of young, healthy people are getting seriously ill from this virus as well. So, and with us being, we're ethnic minorities as well, that makes us a higher risk community as well. So, and the other thing is, the sooner we all get vaccinated, the rates will go down quicker, the NHS will start getting back to work quicker, and hopefully life will start going back to normal as well. So just to let you know, so far, more than 5 million people in the UK have been vaccinated. And another couple of important points, the vaccines themselves don't cause you to get coronavirus. They don't give you coronavirus. And the other thing is they don't alter our DNA. So now I'm just going to start off with talking about how the Oxford vaccine works. So I think we might generally be aware of how the vaccines we're having at the moment generally work. So usually we get a weakened or inactivated form of the germ injected into our body, and that causes our immune system to produce antibodies or special proteins, which learn how to fight off the disease if we were to catch it in future. So the Oxford vaccine works in a similar way. A weakened form of the common cold virus from chimpanzees is modified to look like the coronavirus. And so we get that injected into us, and our immune system produces the antibodies. So next time, if we were to actually catch coronavirus, our body knows how to fight it off before we become seriously unwell. Yeah, actually, Sunil, can we move on to the mRNA one now? There we go. So the mRNA virus, it's a new vaccine, sorry, it's a new type of vaccine. It's otherwise known as messenger RNA vaccine. So the technology has actually been around for a while, but this is the first time that they've mass-produced vaccines. So basically, viruses have these protein spikes on their surface, as you can see from the slide, and they're known as spike proteins. So these spike proteins, they attach to our cells, and they allow the virus to replicate in our bodies, which is what causes us to become unwell. So the way in which this vaccine works is that part of the genetic code of the coronavirus is injected into our arm, and our immune system, basically our immune cells are told to produce this harmless version of these protein spikes in our body, and then our immune system produces antibodies to fight off or destroy these protein spikes. So if in future you were to actually get coronavirus, your antibodies will know how to fight it off again before you become seriously unwell. Okay, and so the next bit, I'm just going to speak a bit about how effective the vaccines are. So in terms of the trial data that we've received, the Moderna virus, which is vaccine, which is one of the mRNA ones, after 2 doses, they've said it's 95% effective. The Pfizer and BioNTech also has similar level of efficacy, and then the Oxford AstraZeneca vaccine has got 70% efficacy. So if we just have a look at this slide, it just compares the COVID vaccines with other vaccines as well. So if we have a look, some of you may have been wondering, oh, AstraZeneca is a bit lower, but actually that's still a very good level of efficacy, and it's higher than the flu vaccine efficacy. So important point to note is, even though it says the flu vaccine efficacy is only 44%, is still incredibly important to get the flu vaccine when you are called by your GP to get it, because we know that both viruses can make even young and healthy people seriously unwell. If you were to get them both together, it could be potentially really dangerous. So now the NHS is offering the flu vaccine to over 50s, those who work in higher risk jobs, and also those with certain medical conditions. So if you are called to have the vaccine, please do book your appointment with your GP. And the other option is that pharmacies are also offering flu vaccines. Okay.
Thank you, Dipti-ben. That is very informative. હવે જીતેન્દ્રભાઈ આપને ગુજરાતીમાં સમજાવ્યું કે આ બધા વેક્સિન્સ કેવી નામ ડેવલપ થયા અને કેવી નામ ફાઇટ કરે આપણી બોડીમાં, ને દીપ્તિબેન એક્સપ્લેન આપને ઇંગ્લિશમાં. વન આપે બધાને ખબર છે અત્યારે કોવિડ તો બધાના માઇન્ડમાં કોવિડ જ છે, પણ તે અધર બીજી બીમારીઓ થાય છે બધાને. ફ્લૂ થાય છે, ફ્લૂમાંથી બી ઘણા માણસો બીમાર થાય ને ઓફ થઈ જાય છે, ને મિઝલ્સ થાય છે નાના છોકરાઓને, ચિકન પોક્સ થાય છે. તો એનો મતલબ નહીં કે આપણે ખાલી કોવિડને જ આપણે વ્યાધિ કરીએ. આ બીજા બધા વેક્સિનેશન લેવાની જરૂરત છે. જો તમારા જીપી તમને બોલાવે આ વેક્સિન લેવાનો, તો જઈને જરૂર આ બધા બીજા વેક્સિન લેવાની જરૂર છે. બધા ચેટમાં બધા ક્વેશ્ચન્સ આવે છે, તમે જ્યાં ધીરજ રાખશો તો by the end of this presentation, we would have answered quite a lot of your questions. And if there are some left over, we will try and answer those. But please feel free to keep typing in the chat box. This is very encouraging. Kanji Bhai, if you don't mind unmuting Nisha so she can do her presentation. Are you unmuted?
Me. Okay, fine. It's okay. Okay, I'm just going to talk about how this, everybody must have a question. This vaccine was approved so fast, and is it still safe? I'll just go through a few things with you. Yes, the vaccine is very safe and effective. The coronavirus vaccine is safe. It gives you the best protection for the pandemic to protect the public. Huge developments in technology have come through, so that's why these vaccines are able. We can be able to do these vaccines. Also, the MHRA, which is the official UK regulator, gives permission for use of all the medicines and vaccines by healthcare professionals. They have looked at these vaccines and they have said they're safe and highly effective, and we have full confidence in the expert judgment and processes. So all the vaccines have gone through a very rigorous approval process. So आपने एम था तो ऐसे कि केम जल्दी फास्ट अप्रूव થઈ ગયું પણ આપની રેગ્યુલેટરી બોડીઝ છે યુકે માં અમેરિકામાં બધે they go through all this બધી ચેક કર્યું છે કે બધું ઇફેક્ટિવ છે અને આપને કોન્ફિડન્સ છે કે એ લોકોએ અપ્રૂવ એટલે જ કર્યું છે બીકોઝ સેફ છે અને ઇફેક્ટિવ છે આપણા પબ્લિક વાસ્તે. Can I have the next slide, please? Okay, just talk about clinical trials and the safety checks. There were many different phases that have been developed. So we may ask, how come all the other vaccines take ages to work? Ne, keem jaldi approved થઈ ગયું છે. So all the clinical trials, they have different phases and they do them one at a time normally. But because of this pandemic, everything was overlapped and the processes had to be speeded up. So everything was done in a faster speed than we would have normally done. MHRA continuously looked at the data available, and the experts were looking at it and talking and looking at the trials and the reviews, and they were doing them very, very quickly. Normally, we would wait for the whole trial to end and each phase to end, and then they review it. But at this time, because of the urgency, everything was done very quickly and talking to the MHRA very, very closely. ખાલી ગુજરાતીમાં ટ્રાય કરું છું સમજાવવાનું because trials દર ફેરે કરતા હોય normally ત્યારે આપણે બધી આખું ટ્રાયલનું ફર્સ્ટ ફેઝ ફિનિશ થાય પછી MHRA સાથે એ લોકો વાત કરે પછી એ લોકો ચેક કરે કે આ સેફ છે કે નહીં પણ બીકોઝ આ પેન્ડેમિક આવ્યું એટલે આપણે બધું વેક્સિનેશન જલ્દી જોતું હતું એટલે MHRA સાથે જલ્દી એ લોકો બધું અસેસ કરતા હતા વેઇટ કરવાની બદલે બધું જલ્દી ટ્રાય કરતા હતા અસેસ કરવાનું so that આપણે બધા પબ્લિકને સેફ રાખી શકે અને વેક્સિન્સ બધા અપ્રૂવ થઈ શકે. Also, apna volunteers, we had lots of volunteers who wanted to take part so that we can get answers to the vaccine. The COVID vaccine trials are able to happen quickly because there were many willing volunteers to take part. People wanted to help. Social media enabled companies to reach out and to enroll study volunteers. So there were enough people to test this vaccine as well. તો આપણે એમ થતું હશે કે કેમ નોર્મલી બધી વેક્સિન્સને આટલી બધી વાર લાગે આ ફેરે આટલા બધા વોલન્ટિયર્સ આવ્યા હતા and they came forward કે અમે હેલ્પ કરી શકશું. We want to be volunteers to find આનું ક્યોર ફાઇન્ડ કરવું છે એટલે એ લોકોને આટલા બધા પાર્ટિસિપન્ટ્સ પણ મળ્યા હતા એ લોકોના ટ્રાયલ્સ વાસ્તે. So એટલે આપણે બહુ હેલ્પ થઈ હતી કે આ બધા volunteers આવ્યા and we gave them vaccine and because contagious virus આટલું બધું હતું we could also monitor કે આ vaccine help કરે છે આ માણસોને જેને vaccine મળ્યું હતું એ લોકો બધાને monitor કરતા હતા. So that was why everything was done properly. The trials also included lots of diverse range of participants, Asians, Doria. The trial ma એવું નહોતું કે ખાલી એક માણસો હતા, બધા different માણસો participate કર્યું હતું, English, Indians, Africans, બધાનું, એટલે બધાના safety effects આપણે બધાએ જોવા મળ્યા છે. Thousands of people have had the COVID vaccine, and the reports of serious side effects is very rare. We will talk a little bit more about the side effects, but ઘણા બધા માણસોને આપે આ COVID vaccine આપ્યું છે અને serious side effects ઓછા જાણવામાં આવ્યા છે. આપે next slides, અમુક slides માં બીજા side effects ની વાત કરીશું. Thank you.
Hi. So I'm just going to talk about when you'll be called to have the vaccine. So this picture shows a ladder, and the people at the top of the ladder are the ones being offered the vaccine first. So that was residents in care homes and staff working in the care homes. And we've been working our way down the ladder. And the vaccine is actually now being offered to some people who are over 70 years of age and those who are clinically extremely vulnerable. So we hope that, we can continue going down this ladder. And eventually in the first phase of these priority groups, aiming to vaccinate all of those over the age of 50, as well as those special groups identified earlier, including health and social care workers. If we go to the next slide, please. So how will you be called to have the vaccine? The NHS or your GP should contact you directly to have the vaccine, and you'll need to be registered with a GP surgery in order to receive an invite for the vaccine. So some of the ways that they might contact you are by text, by email, or a letter in the post. It's important to remember that the vaccine is free on the NHS. There are some scams going around at the moment where people are being asked to put in their card details. These are fake. You should never have to put in your card details in order to sign up for the vaccine. Thank you.
Thank you, Anjana Ben. That is very useful. બધાને instructions કે કોઈ માણસો તમારા દરવાજો પર આવીને કે તમને વેક્સિન દેવા આવ્યા છે, થોડા પૈસા આપો, ડોન્ટ બિલીવ ધેટ. એ તમે કરતા જ નહીં. તમે તમારા જીપી પાસેથી તમને લેટર આવશે ને જેના અંજનાબેને કીધું કે સર્ટન એજ ગ્રુપથી આપે ચાલુ કરે છે. તો પેલા 80 વર્ષથી ઉપરના એ લોકો ઓલા બધા જે હેલ્થ કેર વર્કર્સ હોય, સો અમારા જેવા અમને પેલા બધાને વેક્સિન આપે. પછી 75 ઉપર 70 ઉપર એમ કરતે કરતે પછી 50 વર્ષ ઉપરના હોય એ લોકોને બોલાવશે. એટલે તમને જ્યારે લેટર આવે તો તમે જરૂર જવાનું વેક્સિન વાસ્તે. પણ કોઈ તમારા દરવાજો પર આવે કે ચાલો હું તમને વેક્સિન આપું છું, એ તમે કોઈ દિવસ એક્સેપ્ટ નહીં કરતા. ને કોઈ તમને કે પે કરવાનું, તો બી પે કરવાનું નથી. આ ફ્રી છે બધા વાસ્તે. NHS ઉપર બધા વાસ્તે ફ્રી છે. એટલે કોઈ દિવસ કોઈ તમને પૈસા માંગે તો પૈસા દેવાના નહીં. એ લોકોને પોલીસને રિપોર્ટ કરી દેવાના તમને. હવે આપને કેતનાબેન આપના જીપી છે, આપને જણાવશે કે શું કરવાનું આપના વેક્સિનેશન સેન્ટરમાં.
No, sorry, can you just go back to that ladder slide or when you get vaccinated?
Sure, yeah, I'll do that. Yeah.
So I'm, as I said earlier, I'm a GP in Brent and I'm also one of the clinical directors in Brent. So I've been involved in planning the response in Brent as well as North West London. So locally in Brent, I can tell you that we are now vaccinating all those of 70 and over. And this is very similar in North West London, okay? તમને diabetes કે hypertension કે એવું કાંઈ ખાશે, તમને વ્યાધિ થતી હશે કે, I'm going to be in group 6, which is those that are 65 and above. Okay, so that's something that you need to know. Unless you're over 65, you will be called. If you're under 65 and you have hypertension, blood pressure problems, you've had a stroke, you will be called in the 65 and under group. So you just need to be aware of that. Okay, don't think that you won't necessarily be in the clinical extremely vulnerable group. There are people in that group. And it's at the bottom of that slide, there's a little square in blue that you can read, and they're the clinically extremely vulnerable group. So just to let you know about that. So Sunil, if you can go on to my slide. So like Anjana said, ke tamne kagad aavse, letter aavse, tamne email aavse, tamne kadak text message aave ke this is the invite link cha tama appointment book karo. Okay. You can go onto the link, you can phone, there's I think it's 119 that you call if you can't do it online, or if you don't know how to do it on your phone, you can go ahead and book using those links. जो तमे वैक्सीनेशन सेंटर में ना जाई सको के तमा फैमिली मेंबर तमे ना ले जाई सको के तमा फैमिली मेंबर के तमे पोते truly housebound छो, so don't worry. Okay, by housebound I mean that you cannot get out of bed or you are unable to leave the house. એટલે તમે ખાટલામાંથી નથી નિકળી सकता or તમે ઘરના બહાર walk નથી કરી सकता. તમે housebound નથી, તમે બસ ના પકડી સકો એકલે. Okay, it's that you cannot walk to the, you cannot get to the vaccination center. જો તમે truly housebound છો તો તમને GP ને ખબર હશે already કે તમે truly housebound છો ને record કરેલું હશે ઈ GP computers માં. જો last year ની અંદર બધું change થયું છે COVID માં ને તમે last year ની અંદર housebound થઈ જહો તો please તમે તમારા GP practice ને phone કરીને ને reception ને જણાવી દો કે તમે હવે housebound છો. જો તમે housebound છો તો GPs હવે નીકળ્યા છે બારે તમને vaccinate કરવા. Brent ને North West London ની અંદર આ weekend બધા GPs 18 and over ને housebound patients vaccinate કરવા નીકળ્યા છે. એટલે તમે રસ્તામાં હો, you shouldn't be on the roads, but if you're on the roads, you might see people wearing gowns, masks, gloves, visors, walking around, getting out of cars, carrying vaccine needle boxes and things like that. And these are people who are going around vaccinating the housebound patients. These are the GPs in Brent and North West London that are out vaccinating the housebound patients. Over the next couple of weeks, they will be going down that diagram that Anjana put up of the age groups vaccinating the housebound patients. Okay, so don't worry, the housebound rule, you won't miss out, you will get vaccinated. Okay, so what happens if you get a letter and you book onto the vaccination to go to the vaccination center? Okay, you will need to wear a mask. If there's a medical reason get them a mask na peri sago, then don't worry, you don't need to wear a mask, but please do wear a mask and a mask peri sago to. Vaccination centres are safe. We are following government guidelines. We are keeping the buildings clean. We are cleaning after every single patient. We are wearing our masks. We are wearing our visors. We are wearing our gowns. We are wearing our gloves. So it is safe. Please don't worry कि हम vaccination centre में नहीं जाऊं because मने बीक लागे छे कि मने COVID થઈ જશે. Please everywhere દીની કરજો. Okay, તમે આવશો તમે પહોંચશો સેન્ટરમાં ત્યારે એ લોકો તમારું temperature check કરશે. This is to make sure that you don't have COVID, that you might not know you have COVID and you may spread the COVID. Okay, this is to make sure that you are well enough to have the vaccine. As soon as you arrive at the centre, you will be registered. So receptionists will register you to say that you have arrived. Sunil, can you please change the slide? Next slide, Sunil. Okay. Yeah. So when you arrive, after you've been registered, you will be given information about the vaccine. This is when you'll probably be told what vaccine you're getting, whether you're getting the Pfizer biotech or whether you're getting the AstraZeneca. So the registration page out in a pache tamne explain karse ke tamne kayu vaccine ape che ne in side effects su thei sage tamne su thase ne kevid na tamne help karse. Okay, look, tamne few questions would say. One will be, are you currently unwell or have a fever? Tamne hamra alright che tamne tav nathi ne make sure karse, because કદાચ confusion થાય કે કદાચ તમને COVID છે કે તમને vaccine side effect કર્યું છે. This is to make sure that you are safe to have it. They will make sure that you don't have an allergic reaction or known to have any severe allergic reaction. So એ લોકો check કરશે કે તમને પહેલા કાંઈ severe બહુ bad reaction નથી થયું કે તમને hospital જવું પડ્યું હોય. અત્યારે એ લોકો એમ જ કહેશે કે Pfizer biotech is the only one કે એ લોકો દેશે નહીં if you do have a history of a severe allergic reaction, and that's only if you've got a severe allergic reaction to the Pfizer biotech vaccine. And most people are now getting their first jabs. Not many people have had their second jabs. So the likelihood is that you will get the vaccine. Even if you are known to have a severe allergic reaction or you have a severe allergic reaction on the day, the person vaccinating you is trained to treat a severe allergic reaction, and you will have it within the first few minutes of getting the vaccine. So vayadini karjo tamne allergic reaction thase to tarta usually thase ne ji vaccine apse eloko train karela che ke to treat the severe allergic reaction. So vayadini karjo ke mane khabar nathi ke mane allergy che ke ni ne kadak mane te dise thai. So don't worry. If you're on warfarin, the warfarin tablet leto, please take your yellow book with you, okay? The warfarin, if you're on warfarin, as long as your blood level is below the higher level of normal for you, they will give you the vaccine. So don't worry about that. Other blood thinning drugs like aspirin, clopidogrel, things like that, don't worry, you can still have the vaccine. Just let the vaccinator know that this is what you're on. They will make sure you haven't been in a trial for the COVID virus vaccination. Like Nisha said, lots of people have been involved in the trial, and that's why they've managed to get the vaccine through so quickly. Is there a possibility that I'm pregnant cho, that I'm breastfeeding cho? What the advice is for that, but e-question puts there. Next slide, Sunil. So all of you know this lady. She's the first person to get the vaccine as part of the vaccination program. She's a 90-year-old lady and she's done very well. She didn't have any problems with it. So tamne loko pache vaccine, they say it's in your upper arm, so be aware of that. Now, if you are given the Pfizer biotech vaccine, the advice is to observe you for 15 minutes, okay? So you will be asked to sit in the waiting room for 15 minutes. So tamne Pfizer biotech vaccine apse to e loko tamne kese ke 15 minute tame bare wait karo reception area ma tamne ko check kar they'll keep an eye on you to make sure ke tamne ka reaction na thai. Okay, so if you're going to the vaccination center, be prepared for about 30 to 45 minutes time that you will be in the center getting your vaccine. Next slide, Sunil. Okay, so this is the card that all of you have seen on social media. People have been putting it on Facebook, people are putting on Instagram. Please do so because it encourages other people to do so. So tama vaccine tame loko vaccine kadde ekle pache tamne a card apse ema lakhelu se ke tamne vaccine kayu ap you che ne ke date per ap you che. Now some centers amuk centers tamne second date lucky apse. Some centers, because हमने अत्यारे खबर नहीं कि क्या दिवस vaccines आवे छे ने कितना आवे छे ये लोग को अत्यारे date नहीं लखी आपे, okay? हम लोग तमने सांबर छो news ऊपर के there's problems with deliveries of vaccines, okay? दर रोज हमने about a week in advance हमने खबर पड़े कि अगला vaccines आवसे, okay? Now हमने within a week we have to book all the patients in. So we don't normally know how many vaccines we're going to get until a week before. So that's why at the moment, some centers do know and will book that second dose in for you. Some centers may not. I suspect most centers won't book that second dose. Most centers atyare tamne second dose atyare book nahi kari ape, but tamne invite karse. And the likelihood is they will telephone you to book you the second dose when the time comes. The number 2 is where your second dose will be given. Okay, so someone's asked a question, I think, about whether we will get the same vaccine for our second dose. The attempt will be to give you the same vaccine for your second dose. So we know on this date, someone's had dose number 1, and we know 12 to 10 weeks after that is dose number 2, and we will try and make sure that you get the same vaccine for your second dose. Okay, so it's important you do go for your second dose. So this is your card. It says keep it safe. You don't need to, don't worry. Your GP has a record of it. If you lose it, don't panic, but I think it's nice to have it. Okay, next slide, Sunil. Okay, so what are the side effects? Okay, so the side effects are quite mild and they're very short-lived, okay? And also not everyone will get side effects. Don't forget, we've all had vaccinations. Apne India jaungu to apne vyadi nathi thati ape tartaj injections mare aapsi. Apne Kenya jaungu, we go and get our injections. Koi vyadi nathi karto tyare injections maro pare tyare. Okay, so ne MRE vaccinations ma side effects che. Jem badi dawa ma side effects hoye, ne badi vaccinations ma side effects hoye, a vaccination ma side effects che. But thankfully, most of the side effects are mild and they're very short-lived, okay? So you will probably have the side effects for a couple of days. Not everyone will get it, okay? So the most common side effects are sore and a heavy arm, like you get with the flu vaccination. Kadak tama hat jirik dukhe betan divas mate, jirik tamne thako lage, tama sari dukhe, tama ang dukhe, jirik kadak headache hoy, kadak tamne vomiting jau thai, but that's very rare. Ne kadak tamne mild fever hoy. Okay, tamne side effects thai, you can take simple painkillers as long as you're normally able to take simple painkillers. So you can take paracetamol as long as you're normally able to take paracetamol with these side effects. They won't affect the way the vaccine works if you take that, okay? So let's say you have your first vaccination and you get these side effects. Please do not then say, I will not have my second dose. Please go ahead and have your second dose. Because although the first vaccination gives you some protection, the second dose will give you protection for longer and it will give you better protection. So please go ahead and have it. The only reason not to have your second dose is if you've had a severe allergic reaction to the first dose, and you will know and your doctor will tell you not to have the second dose, okay? The other thing is that you may, like the slide says, you might get a mild fever. If you have a high fever and the fever is prolonged, it's possible that this may not be related to your vaccine. This may be because you have an other illness or COVID, okay? So, tamne side effects high, so please tama second dose toy leva jajo because tama second dose tamne murgu ganu protection up se, okay? Tamne fever bo high thai, ne bo long time thai, kadak vaccine related na hoy, ne biju kok tamne fever, biju kak illness ke COVID, tamne kadak fever kartu hoy. If you're worried, then please call 111 and they will advise you on what to do. Okay, so if you have symptoms for more than 3 to 4 days or up to a week, please call 111 and they will guide you on what to do. Thank you, Sunil.
Ketnaben, that is very, very informative. Thank you very much. Ketnaben, I know we're going to take question and answers later on, but there are two relevant questions if we can answer them now from the chat, if that's okay. So one is if someone has had a vaccine and within a few weeks they get COVID, then can they take the second dose? And so when should they take the second dose?
I think Dhruti is going to answer that one actually.
Okay, we'll come to that. Okay.
If she doesn't, I'm
yeah, we'll answer that. How about someone who has a transplant, kidney transplant?
Yes, so I think they are going to be in the critically, the clinically vulnerable group.
That's right.
But if if you've had a kidney transplant, you are still under specialist care, okay? And you can ask your consultants for support and advice, and you can always speak to your GP as well. We're here to help. You know, we are definitely not closed. We're on the end of a phone if you need us. Our doors are still open. Press the buzzer if you need us. But please only seek advice and come and see us if you need to see us, because as you can see, we're busy doing the vaccination and we're trying to make sure that the really sick people are being looked after. So we don't, we want to make sure that we're giving you enough time. So if you're worried, please ring the GP. We can help. Talk to your consultants. They can help as well. We're here to help.
That's right. And exactly. Chemotherapy, they've had transplantation, then these two vaccines are safe. We've looked into it and we can confirm it's safe. But as Ketnaben says, double check with your GP. They're always there, or your specialist, to answer these questions.
Yeah, so I think if you're on immunosuppressants, they're saying that you may not mount a good response as we would expect, but still you should have the vaccine because actually you're quite vulnerable if you are on immunosuppressants. So immunosuppressant drugs, so tamne khabar ase tame immunosuppressant drugs upar choto, but tame immunosuppressant drugs upar ho to tame kadak tama response a vaccine no won't be as good as a non-immunosuppressed patient, but it's important check it tame still vaccine lo because tame vulnerable to a virus mithi.
Thank you. Now we'll switch a little bit to a different group of people. They're not patients, they're people. And Hina Ben will cover that topic for us. Hina Ben?
Yes. So can I have the vaccine if I am pregnant or breastfeeding? Well, the simple answer is yes, because the vaccines are thought to be safe in pregnant and breastfeeding mothers, as there is no live material from the coronavirus in the vaccine. However, like most medicines and vaccines that have been developed, these haven't been tested in this group. So it's the current guidance is that these are not routinely offered to all pregnant ladies at the moment. There are two situations where you might be offered this if you are pregnant. And number one, that's if you're high risk of catching the virus because of where you work. And number two is that if you have a health condition which makes you very high risk of developing severe complications of COVID. So in these situations, the vaccine is discussed with you, and the discussions are around the risks and benefits of having the vaccine, and you can do that with your doctor or your consultant. And if you are high risk because of work, you should ask your work to do a risk assessment as soon as you find out that you are pregnant to minimize the risk of catching COVID. It is deemed to be safe for breastfeeding mothers if you are otherwise going to be eligible. There's no need to avoid becoming pregnant after the vaccine. And if you do become pregnant between the doses, the current guidance is to delay the second dose unless you fall into one of the above groups. And for all pregnant ladies, regardless of whether you're going to take the vaccine or not, it's still important to continue to take precautions with the masks, hand washing, and social distancing, especially if you are above 28 weeks pregnant, because there is some evidence to suggest that people who are more than 28 weeks can be at risk of developing severe complications in pregnancy. Thank you.
Thank you, Hina Ben. Very, very important topic. Apno, pregnancy, breastfeeding is very, very, people worry about all this. And as Hina Ben has said, it is safe in taking the vaccination. And also remember that pregnant women do get affected by COVID as well. We have some sick women with COVID, so we all need to be careful and take care. Next, we have Dhruti Ben, who will cover some other points on, again, about the vaccination.
So a lot of people have had, I've seen in the chat, a lot of people have been asking about whether they should still have the vaccine if they've had COVID before. And generally the answer is yes. The reason for that is there is more and more evidence to suggest that the amount of antibodies that you retain after having COVID naturally is variable between people. So currently, by having the vaccine, it's establishing a reliable antibody protection so that it can protect you for a longer period of time. So tamne pehla thyo hoy, to tamne antibodies ta hase, but our vaccine is a more reliable way ke tamne mahino pachi tamne antibodies toy pan hase tyare. But tamne if you have a COVID infection right now, the advice is to wait about 4 weeks until the point of 4 weeks from when you've had a positive test or 4 weeks from when you started having symptoms, and make sure you get the vaccine once you're well. So 4 week tame baad jojo tamne COVID hamra che to 4 week pachi tame vaccine lei sakso. The other question that people have had is that they've had the vaccine, can they still spread the virus? And this all boils down to the central core message that the government have been giving about hands, face, and space. So the vaccine, you can spread the virus. You have to remember that the vaccine helps prevent death. So you can still become unwell. It will just try and prevent you from dying and prevent you from having the really bad side effects. So you have to, even if you get the vaccine, you have to bear in mind that you keep washing your hands after you've come back from the shops or before you're eating. Make sure you wear a face mask. With the face masks, please do not wash and reuse the disposable ones. If you have a cloth face mask, you can wash and reuse those. And please keep social distancing. So Gujarati ma tamne vaccine toy pan mali gyo ase em nathi ke tamne virus tame haji transmit na sakari sakso. Ji vaccine tamne malyu che, it's more to prevent death. Tame mari na jao ke tame kai hospital ni admission ke vadhare tame bimar na thao. So jare tamne vaccine male toy pan tamne hath dhwana, face mask perwana ne safe social distancing karvu joy. So please, 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 as much as you possibly can, don't get complacent after getting the vaccine. It's really, really important that we keep to that message. Thanks, Sunil.
Thank you. There are some loads of points in the chat box.
Sunil, we can't hear you very well.
Just hold on. I'll try and see if I can rectify that.
Yeah, we can hear you now, Sunil.
Yes,
We
yes.
can carry on.
Now, yeah?
Yeah.
Okay, good. So we've covered loads of points, and now we'll go through what we call myth busters. કે આપને કોઈ આવીને કાંઈ WhatsApp માં કે Facebook માં કે ગમે તે સોશિયલ મીડિયામાં કે even in the post કાંઈ આપને ઇન્ફોર્મેશન આપી હોય કે એ સાચી ઇન્ફોર્મેશન છે કે ખોટી ઇન્ફોર્મેશન છે. એટલે આપણા ચેટ બોક્સમાં બી આપણે જોઈએ છે there are loads of things which are coming કે માણસોને બીક લાગે છે કે સેફ છે કે નહીં. તો અમે ક્વિક ફાયર થોડા ઘણા પોઈન્ટ્સ અમે કવર કરશું. તો આ તમારે ડાઉટ કે તમારે ઓલે બીક હોય નીકળી જાય. તો ફર્સ્ટ થિંગ.
Sorry, Sunil, your microphone seems to be covered by something. Can you uncover it or whatever?
I'll change it to something else now.
That's better. Now I can hear you now. So
you hear me?
Yes, better now. Yeah.
Okay, good. So, Dipti Ben, the first question we have is this vaccine safe or not?
So yes, it's absolutely safe, and I think it's been explained quite well in the previous slides. But just to reiterate, I think we're all aware that the UK has very strict and rigorous standards when it comes to testing new medications, vaccines, and things like that, and they would never approve something that wasn't safe. So absolutely, yes, it is safe.
Thank you very much. Dhrutiben, tamaro waste question. Is vaccine vegetarian?
So
or is
yes,
not vegetarian?
It is vegetarian. I know somebody in the chat wanted to find the ingredients, and you can find it online on Public Health England for both AstraZeneca and the Pfizer vaccine. Neither of them contain any animal products whatsoever. So no egg, no dairy, no animal products at all.
Thank you very much for that. That is very useful. Next question છે કે આપે કેતનભાઈ વાસ્તે. Ketanbhai, home remedies will cure the COVID. Is that true or not?
Unfortunately, it's not true. There are lots of WhatsApp messages going around to say that if you drink adu pani, or if you eat some loving in the morning, if you have some daj, some karela, Donald Trump even said domestos, all of these things, they're all false. None of these things help with COVID, okay? There are also some people selling these coronal tablets in Wembley, Ealing Road. They get sold in India as well. They do not help with COVID, okay? So do not, you don't need to do any of these things. Take the vaccine, that's the best thing you can do. At the moment, there is no cure. You just need to take the vaccine and maintain the best health you can for yourself.
Thank you very much, Ketanbhai. Very, very useful information. अपना वडीलों ने भी आपे के ओके आपे सवाना बदे लेता हुए बदे herbal medication के आपे गार्लिक के जीबी आप लेता हुए कितने थे कि बंद करना हो पर ये substitute न थी कोविड वैक्सीन वास्ते कोविड वैक्सीन लेवानी भी जरूर है इन ऊपर जेना आपने ब्लड प्रेशर होए तो आपे ब्लड प्रेशर ની દવા તો લઈ છે બ્લડ પ્રેશર કંટ્રોલ કરવા વાસ્તે ડાયાબિટીસ હોય તો ડાયાબિટીસ ની દવા તો લઈ છે આપે કંટ્રોલ કરવા વાસ્તે સેમ રીતના વેક્સિન લેવાની બી જરૂર છે કોવિડ ને કંટ્રોલ કરવા વાસ્તે કોઈએ પૂછ્યું ચેટ માં કે does it contain fish? So going back to Dhruti, does it contain fish?
No, the vaccine does not contain any fish.
That's right. It doesn't contain fish. It is vegetarian. And also, even before, if someone else asks, does it contain alcohol? It doesn't contain alcohol. The amount of alcohol is so small, it's less than what you get from eating a banana. Alcohol no level એટલું છે કે આપે banana ખાય, કેરા ખાય, anything be એમાં જે આપને alcohol મળે, anything be ઓછું છે. So there is no alcohol. It is vegetarian. So don't be worried about that. Next question, Preeti Ben वास्ते. Preeti Ben, आपे steam inhale करिए, ये आपने protect कर से के नहीं?
There's no evidence for this. બધા કે નાસ લ્યો, ગરમ પાણી પીવો, I hear that from everybody. But it's not true because the virus only dies at 70 degrees centigrade, and this is false advice, and it does not protect you from COVID.
That's right.
Or treat you.
Yes. 70 degrees પાણી આપે આપનો હાથ એમાં રાખે તો આપે ભરી જાય. તો obviously આપે inhale કરવું કે it's not possible to do that, and it's not going to kill the virus. Where the virus is hiding, the inhalation steam will not reach that. We need to take the vaccine and follow the guidance from the doctors. Next question, Hina Ben wase che, and this is quite a interesting one. Okay, Hina Ben, does the vaccine apno DNA, apno what makes us, does it modify the DNA? Kya ape mutate thai jaso?
No, it doesn't. I think there's a lot of things going around on social media about this kind of thing, and it's just scare tactics, really. As Jitendra Bhai and Dipti-Ben were talking about, the vaccine exposes your body to the viral protein. So it makes your body recognize when it is exposed to the actual coronavirus. And so it can fight like the army, like those pictures that you saw earlier, and fight to develop a response to the coronavirus. So it doesn't modify your DNA.
Thank you very much. એટલે એનો મતલબ કે કોઈને એમ થાય કે આપે વેક્સિન લઈશું તો આપણા છોકરાઓને કે આપનો આપને બ્લાઇન્ડ થઈ જશું કે આપના હાથ ટૂંકા થઈ જશે કે એવું DNA, it will not change our DNA. Okay, so this is a fairly safe vaccine, and it is important that we take it. Next question, આપે કેતના બેન હશે કે હું અત્યારે વેક્સિન લઉં તો government will be able to track me. The vaccine contains a chip that can track us. So ગમે ત્યાં જાઓ તો government will know where I've gone. Is that true or false?
No, that's not true. So the vaccine and the guy chip tracker ke kai nathi. I know ke apna partners now, parents would like to keep a track of us, but fortunately there is no tracker in the vaccine.
So people forget કે આપને પાસે અત્યારે બધા આપણે સાંભળે છે 500 માણસો ઉપર માણસો સાંભળે છે બધા પાસે મોબાઈલ ફોન છે. The government can track you on your mobile phone. તમે એની વ્યાધિ નથી કરતા, પણ તમે વ્યાધિ કરો છો કે વેક્સિનમાં એ લોકોએ ચીપ નાખી દીધી છે, પણ આપણે ફોનની વ્યાધિ ન કરતા. ભલે આપણે ગવર્મેન્ટ ફોન આપણે ટ્રેક કરે, પણ આપણે વ્યાધિ થાય છે કે something that is going to help our health કે આપણે એની વ્યાધિ થાય છે. As Ketnaben says, there's no chip in the vaccine, and don't worry about that.
I think, Sunil, the other thing I've heard is Bill Gates is going to be able to keep a track of us because the vaccine is associated with Microsoft. That is not true. I'm sure Bill Gates got better things to do with his time than keep a track of all of us. So don't worry about that.
That's right. The next thing, Ketnaben, again, same to you. All about the phone mask, the new technology, 5G technology. COVID is caused by 5G technology. Is that true or false?
No. I know we all want to put our phones down and spend more family time and looking after ourselves, but there is no association with 5G and COVID.
Thank you. However, something which is quite close to other people, quite a lot of people, COVID vaccine developed it's been developed from human fetus. Babies born not test develop. So, Anjana Ben, the vaccine contains tissue from human fetus. Is that true or false?
This is false. The vaccine doesn't contain any tissue from human fetus or any animal tissue either. As Ruti said, it's vegetarian.
That's right. Thank you. Jitendra Bhai, tamara waste, this is quite important કે આપણે બધા પાર્ટી કરીએ. ક્રિસમસ ટાઈમે આપણે ઘણા બધા માણસો ભેગા થયા હતા, hoping કે એ લોકોને આ થશે, they will be able to get immunity. So the vaccine is a waste. We should just wait for herd immunity. Is that true or false?
આપણે હમણાં સુધી તો જોઈ છે કે વર્ષ થઈ ગયું છે, આપણે ટ્રાય કરી છે કે હર્ડ ઇમ્યુનિટી બોરિસે સ્ટાર્ટિંગમાં ટ્રાય કરી કે હર્ડ ઇમ્યુનિટીથી મળી જાય ઇમ્યુનિટી, પણ તમે જોયું કે એનું શું પરિણામ આવ્યું છે કે એટલા બધા માણસો મરી ગયા છે. સેમ થિંગ મને લાગે બ્રાઝિલમાં પણ એ લોકો એમ જ ટ્રાય કર્યું હતું કે હર્ડ ઇમ્યુનિટી ટ્રાય કરે, પણ એકને પણ સેમ જ પરિણામ આવ્યું કે માણસો ઘણા બધા મરતા હતા. એટલે આઈ થિંક હર્ડ ઇમ્યુનિટી કામ કરે, પણ ઇટ કેન ટેક ઇયર્સ એન્ડ ઇયર્સ, લગભગ 10 વર્ષ પણ નીકળી જાય કે હર્ડ ઇમ્યુનિટી થાય. ત્યાર સુધી તો કેટલા બધા માણસો મરી જશે ત્યાં સુધી. તો એટલે બેટર છે કે આપણે વેક્સિન બધા લઈ લઈ. તો તમે જોવો છો આ ગ્રાફમાં કે કેટલા બધા રેડ ડોટ્સ છે એ બધા માણસો જે મરે છે એ છે. તો આપણે એ ઓછા કરવા હોય તો વેક્સિન લેશી તો જ લગભગ જેમ બધા લેશી ને તો જ કામ કરશે. નકો આપણે એક બીજાને સ્પ્રેડ કરી રાખશી ને માણસોનું મોત થયા રાખશે. તો બેટર છે કે આપણે હર્ડ ઇમ્યુનિટી ના લઈને વેક્સિનેશન લઈ લઈ બધા. Thank you.
Thank you very much, Jitendra. Next question is a very interesting one, which Nisha will give you an answer to. Ke ape kanbi che, most of the people on this call are kanbi. Ke ape khichdi khaye, ne ape vegetarian che. Biji kai apne ma kai khot nathi, biji kai khoti habits nathi. So apne COVID na થાય. So you can't get COVID if you eat khichdi. Khichdi here I've just put it કે આપે કાઈ ખોટી આપની આદત નથી તો આપને COVID ના થાય. તો નિશાબેન આપને આનો આન્સર આપશે.
Hello. I think આ બધું ખોટું છે. આપને બધાને એમ થાય છે કે ખાલી બીજા બધા જે બીજું બધું ખાય છે એ લોકોને જ થશે કે ચાઇનાથી આવ્યું છે, બેટ્સ ખાધું એટલે કોવિડ થયું છે. એવું કાંઈ નથી. આમળામાં બધાને આ કોવિડ અફેક્ટ કરી શકે છે. કાંઈ તમે ગમે ત્યાં હો દુનિયામાં તમને કોવિડ થઈ શકે છે. એવું નથી કે ખાલી યુકેમાં જ થાય છે કે ખાલી યુરોપમાં કે એવી રીતે થાય છે. કોવિડ ઇઝ સ્પ્રેડિંગ. So we all have to be very, very careful wherever you're living. It is not, it's not as if it's not going to come to your country, whether you're in Kenya, Uganda, wherever. It can spread everywhere. So please, all of you, be careful. It does not discriminate against anyone or whatever your diets are or your backgrounds. So it can affect anybody in this whole world. So it's best to be safe than sorry. So everyone be careful, stay safe out there.
Thank you, Nisha. That's very helpful. Now, next, we've gone through loads of information, and there are some questions that have been coming through the chat box, which we will try and answer. Most of them we have answered. The first, I will try and answer a question which I'll try and answer a question which came about the first and the second dose. And at the beginning of this presentation or the beginning of this webinar, we mentioned that the guidance keeps changing. You saw our Prime Minister yesterday on TV talking about when the second dose should be taken. So rather than us committing, this is the timing, we should wait from the government guidance what should be the ideal timing between the first and the second dose. Okay, so why rather than us answering that question, let's get that guidance from the government. The government is trying their best. They want to make sure at least as many people get the first dose. If you think about it, after 100 months hoy ne apni પાસે 100 doses hoy, we can choose કે આપણે 100 માણસોને એક ડોઝ આપીએ કે 50 માણસોને 2 ડોઝ આપીએ. તો 50 માણસોને તો ના મળ્યું કાંઈ. So that is the sort of thinking the government is doing as well. So just bear with us or bear with the government to find out when the timing of the first and the second dose is.
So no, can I just add, currently
Yeah,
the
sure.
guidance is
Please.
12 weeks. So like I said in the presentation, so that is the current guidance. As Sunil said, things are changing every day. So I think just wait for the changes really.
That's right. Thank you. Rajesh Bhai had asked something about COVID, if you've had COVID and can you get vaccination. So Dhruti Ben answered that very well. Neha Ben asked whether if you've had vaccine, then you get COVID, then can you have the second dose? So Ketna Ben answered that very well for you. So there's a question about the variant of different variants of COVID. Now this COVID virus is very clever, and all the viruses are clever, and they keep mutating, okay? So we have the British variant, we have the South African variant, we've got the Brazilian variant. Now the question is, was the initial test done on the variants? Of course, they were not done on the variants. because these variants have come afterwards. However, the scientists have done tests on the new variants to see if the current vaccine is suitable for the variants we have. And again, the government guides us with that. And they, at the moment, they're saying that the new British variant is covered by the current vaccines we have available. So again, the government is doing their best, and we just follow what the government is saying. The question is, if you have the COVID, you've taken the vaccine, can you get a variant COVID affecting you? We don't know the answer to that. And I don't think anyone will have the answer to that. So we have to wait and see and hope for the best. If we all get the vaccine, then we can reduce the chances of that spreading further. There's a question, Ketna, if you can answer, if you don't mind. What is the GP follow-up for patients who've had COVID?
So it's variable. Most of us will check up if you've been diagnosed with COVID. So once we get notified that you've had COVID, we will ring you to make sure you're okay, give you guidance and advice. This is what we're doing locally, and check on you. And then we will tell you when you should seek more support if needed. We are available. So if you want any support, you can always ring us. We will direct you to services as well that may be able to support you. So if you're by yourself, you can't go out and you can't get shopping, we will tell you who can come and help you. If you can't get your medication, we will direct you to services to help you with that as well. So we have lots of people that we can contact or give you details of to contact if you need support. And we are available. So if you're worried about your symptoms, you feel that you're not getting better, you've got you know, the 111 number, and you can always call us as well. So we are there if you need us.
Just to add to that, sorry, I finished.
But we do check in on you once we've been informed that you've been diagnosed with COVID.
Go on, Jitendra.
I just wanted to say, if you've had COVID and you are still having symptoms, what we have been doing in the hospital is we have been making sure that the risk of having thrombus is not high, so that so the GP should also be doing a checking on that. Also, that's also important. That if you have had COVID, you have symptoms, or even if you don't have symptoms, make sure that you are assessed about your thromboembolic risk, because that's very important in COVID.
Thank you, Jitendra Bhai. There's a question from V. Hirani asking, okay, what are the dosages of the first and the second dose? Are they the same? Anisha tells me that they're the same dose. You're giving the first dose and the second dose are the same. One question is, can you become positive of COVID after your vaccination? Someone wants to take that?
Yeah, I can take that.
Yeah.
So because the vaccine does not contain any live virus, it does not contain, you know, the virus that can cause COVID itself, you cannot get COVID from the vaccine. However, you can still catch COVID from elsewhere. So you can still become COVID positive even after you've had the vaccine dose.
Thank you. Thank you very much. The other question is about antibody testing. Is it advisable to do antibody testing after, and if yes, then where can someone get antibody testing? Ketna, you may be better placed to answer that.
Yeah, so we're not really doing antibody testing, if I'm honest with you. The other GPs might want to come in. I think because we don't know what the benefits of having these antibodies are and how long you're going to have the antibodies for are. Even if you have got antibodies, the advice is still to get vaccinated. So we're not really testing for antibodies. It was initially available if you were part of the NHS, but I don't think we're really doing it anymore, no. To be honest with you.
I agree. We are not doing it anymore. And I don't think the message out there is that you should take the vaccine, and that is the best way of protecting you. The antibodies doesn't give you an answer.
So I know people who had COVID who didn't test positive for antibodies, and I know people who've had COVID and have tested positive for antibodies. So we don't know how long these antibodies last for, and we don't know what the benefits of these antibodies are. So like Sunil said, please take the vaccine, because that's the only way to really protect yourself and prevent you getting a bad episode of COVID, really.
Sure. Thank you. There's a question on the chat on, I think we covered a part of this, but someone is under the age of 50 and has had a kidney taken out. Are they in the high risk category or not? So I think, again, your GP will be able to guide you with that. There is a table onto which you'll go, and the GP will be able to guide you with that as well.
They can also look at the table that we put up on the slide, Sunil, afterwards. So there's details on that as well.
Sure. Thank you. I think we are coming up to that. There are a couple of positive things. All the things on the chat are positive because they ask questions, but there are people who within the chat are saying that we should all follow the rules that have been set out by the government. And as you can see, that's what we have been trying to tell you all. Okay, please follow the rules. If we follow the rules, we will come out of this together. If we do our job, we will come out of this together. Lots of people have said that they've lost their loved ones. So please, 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 people are losing their lives. So let's all play our part and follow the rules. The other thing is about the social media. There are lots of things in the social media which are incorrect. And as we've mentioned today, and we try to highlight some of the incorrect information so that you are now feeling comfortable. કે તમે બધા comfortable કે તમે જેને vaccine લેવો કેવી નામ તમે તમારા self-ને ધ્યાન રાખશો, social distancing, mental health, and also not forgetting exercise as well. So I think as we are coming to an end, we have answered most of the questions. And I will ask, there's one question which I'll ask Kanjibai to answer, is what's going to happen to this presentation after we've done this presentation? Because Kanjibai has put it in the chat, but if you can mention it here as well. Kanjibai, do you want to take that?
Yeah, I can take that, Sunil. So we have been recording this presentation, and so it will go onto the SKLPC YouTube channel. So if you go into YouTube, whether it's on your phone or your laptop or your iPad, search for SKLPC, and you will see this recording on YouTube. And that way you can encourage family members who may not have had time or not able to attend this webinar. They can look at it on YouTube. And as you know, YouTube can be viewed anywhere around the world.
Thank you, Kanjibai. That is very helpful. One other thing, someone is asking about the prices of the vaccines. Don't worry about the prices of the vaccine. It's all free. NHS is looking after you, and please take the vaccine. Doesn't matter whether you take you offer the Pfizer or the AstraZeneca, the Oxford one, or in future another one. But just don't worry about the pricing, but don't pay. That's the key. If someone is asking you to pay, then that's not the correct vaccine. They're trying to steal money from you.
So no, sorry, can I just add, sorry to interrupt you.
Yeah,
so there was a question on there. So what if I want to have one particular vaccine? The advice is take the vaccine that you're offered, because it will delay you getting the vaccine. So at the moment, like I explained, we don't know which vaccine we're getting. We're getting the vaccines delivered we're told a week before what vaccines we're going to get. So if you get offered the Pfizer one, you turn up and you're told it's the Pfizer one, or you're told a week in advance it's the Pfizer one, and you say, well, no, I want the AstraZeneca, we might not get a delivery of the AstraZeneca one for a couple of weeks. And actually, you then can't be booked into that slot. You then go back into the system to be booked in. So what we don't want is you to be missing out. And actually, you know, they're both very good. They're doing its job. So take the vaccine when it's offered to you. We don't want you to then catch COVID and become unwell with it. So it's important you take the vaccine when it's offered.
Thank you very much. And one thing, someone in the chat wants us to reiterate, no mixing of households. So again, going back to follow the rules. Please follow the rules, and that includes not mixing of households at the moment. Okay. I'll show you the last slide, and I think we've covered most of the things about the last slide, and then we'll hand you back. So again, we have covered the other vaccines that are still we have to take. So we should encourage our elderly parents કે આપના વડીલો હોય flu vaccine લેવાનું ને follow the government guidance. The government is working really, really hard so that we can then lead a normal life. મને ખબર છે બધાને હોલિડેમાં જવું છે, બધા થાક્યા છે, પણ આપણે અત્યારે રૂલ્સ ફોલો નહીં કરીએ તો એ આપણી ઈચ્છા ડિલે થતી જશે. So let's follow the rules and we can safely do what we want to do. One final thing before we finish is the uptake of the vaccine in the Gujarati community. We have statistics about the Gujarati community. We don't have statistics about the Kanvi community, but with the Gujarati community, the uptake is only 56%, which is very, very low. We should be making sure the uptake is much, much closer to 100%. 56% is very low. And we hope as a group, the panel members have worked really, really hard to put the information together. And we all mean sincerely from deep our heart, please follow the rules. And if you're invited for the vaccine, please go and have the vaccine. Thank you very much. And we will hand over back to Suryakant Bhai, who will pass the closing remarks.
Thank you. Are we good, Praveen?
Yes, carry on, yeah.
Thank you. Thank you, everyone, for joining this seminar this evening. On behalf of SKLPC UK Management Committee and the trustees, we would like to thank all the doctors in this panel, pharmacists for joining this evening's seminar. Thank you to all the valuable time that the public have given in joining this evening's seminar. I'm sure you've sent a lot of comments in the comments box. By reading those comments, we can see that people have really appreciated this. Gujarati ma explain karyu apne, English ma explain karyu. So I would sincerely like to thank the public as well as the panel of all the doctors and the pharmacists who have joined this evening, done a lot of hard work preparing this. So my thanks goes to, once again, to all the doctors and the pharmacists who have joined. I'd also like to now mention all those names. As head of the panel, Dr. Sunil Budia, who was leading this, who had worked tirelessly fitting in his schedule to make sure that this actually happens, and it happens in a fashion that is understandable to a wider audience of our community and anybody else who's joined in. Dr. Ketana Halai, Dr. Hina Pindoria, Dr. Jitendra Siyani, Dr. Dipti Hirani, Dr. Ketan Vekaria, Dr. Priti Varsani, Dr. Anjana Vekaria, Dr. Dhruti Hirani, and Nisha Budia in the pharmacist who's helped us with some information regarding the medications and everything else. I would also like to take the opportunity to thank Veljibai, our SKLPC president, who's been leading this and making sure this evening's seminar ran smoothly as possible. And without the help of the team who've been behind the scenes in the IT team, Praveen Bhai Khivani, who has been involved deep into it. He's been on the phone, on the webinar, making sure everything is working. And none than the other, Kanji Bhai Hirani, Vinod Bhai Halai, who joined in to set it up as well, Kamlesh Hirani, and many others. I may not be able to give all the names out. So once again, thank you to the panel. Thank you to the support team who have made this possible. We look forward to perhaps doing some more seminars like this, depending on the demand. Yes, there's been a good comments coming in today, and there's a lot of people who have really appreciated us doing this. Ghare betha betha kadach tame kalak ke dod kalak information mate tamne આ માહિતી મળી એ જરૂર તમે વાપરજો. તમને કાંઈ ક્વેશ્ચન હોય તો તમે તમારા જીપી ને કોન્ટેક્ટ કરી શકશો. આપણા સુનિલભાઈ ડોક્ટરે કહ્યું એ પ્રમાણે. અને most importantly, with the demand, if possible, we will probably set some further seminars in the future. In the meantime, I hope you all join in other SKLPC events, and would like to thank you again. I'll hand over to Velji Bhai if he's got to add anything before the end of this session. Velji Bhai?
Yes, so ભાઈ તથા બહેનો આપ સૌનો ખૂબ ખૂબ આભાર. જેમ સૂર્યકાંતભાઈ કહી ગયા તે પ્રમાણે આપણા યુવાન ડોક્ટરો કહેતા દીકરીઓ દીકરાઓ કહીએ તો કહી શકીએ યુવાન છે અને કેટલી બધી મહેનત કરી અને આજના બધાને તેમની યથાશક્તિ અનુસાર બધાને પૂરેપૂરી માહિતી સમજાવી છે. તો આશા રાખીએ છીએ કે જ્યારે જ્યારે પાછી આવી રીતના આપણે સમાજમાં આપણા યુવાન દીકરાઓ અને દીકરીની જરૂર પડે ત્યારે મને પૂરેપૂરી ખાતરી છે, આઈ એમ very confident that all our professionals will join us, give us hand for the betterment of our community. So again, on behalf of everybody at SKLPC, that is the Board of Trustees and the Managing Committee, my heartfelt thanks to all those who joined today, and especially to the professionals, doctors, and obviously, how can I forget Dr. Sunil Bhai, who has taken the lead and made this webinar very good, very informative, and a good number of people taking part, 590, not a bad figure. So again, many, many thanks, and may God bless you all and keep in touch. Thank you very much.
Thank you, Veljibhai. It's the team that did the work. I just put it together. Is the team who really worked hard over the last few weeks. Thank you very much to the team. Thank you.
Thank you. Good night. God bless. See you all.